One of the major events was a presentation, obviously, of the pembro plus epacadostat data today, showing no benefit. One of the first trials in the new era of immune checkpoint blockade, which turned out to be completely negative, no benefit. So the intervention targeting IDO is probably dead for some time, so which is, I think, important message for the community, because all the programs for using IDO inhibitors have collapsed, not only in melanoma but also in other entities. So results with major impact in drug development.
Still important to take ownership of negative trials and use that to guide care going forwards.
Yeah, I think it's also, I think it's an important lesson also in terms of how we now move forward, combining our backbone checkpoint blockade antibodies with additional agents. And I think that's, so understanding mechanisms is of critical importance and not just adding one thing to the other. I mean, the interesting thing with epacadostat was, and IDO inhibitors, that there was no single agent activity. And no single activity, no side effects, no additional effects in combination with PD-1 antibody. So I think, so now thinking about it, listening about it, no surprise, but you know, there was so much excitement after the phase 1-2 study data with a PFS of more than or close to 2 years. Now it's back to basis. Updates of the second adjuvant treatment modality, which is already licensed in the US and will be available in Europe in roughly September, which is an update of nivolumab survival data. So also nivolumab shows a survival benefit in stage 3 melanoma patients, and that's new. We have known from the ASCO presentation last year that there is a relapse-free survival benefit in comparison to high-dose epi, and now we have seen also a benefit in overall survival in comparison to high-dose epi, which is good news for those patients. Safety profile is excellent.